So we have a very special event planned for you with one of our very own board members joining us for this conversation. Heather Knight is one of our board members, and she is the general manager and president of Baxter International. Hi, Heather. She'll be
Connie.
talking. Well, she'll be talking today with one of our Technovation teams, Glukeep, who used what they learned from the Technovation program to develop an app that helps diabetes patients receive easy, accessible, and evidence-based care. So I'll hand it over now to Team Glukeep to introduce themselves, and then Heather's going to have a really great conversation with them about the healthcare industry and how young women can really innovate it to improve the lives for everybody.
Hello everyone, we are Team Glukeeps. We are 4 teenage girls that were brought together in boarding high school, which is STEM, stands for Science, Technology, Engineering, and Math. We have become friends from the first year through our interconnected interests that were reflected in our Glukeep experience. And by being in a sync, we had much more fun and experience, and we went through a lot of trust together. So let us introduce each ourselves. And I'll start by me again. I'm Aegis Fon, a second-year medical student. My initial interest in medicine stemmed from my excitement about the human biology, how complex and yet harmonically it works and it functions. Medicine drew my attention through different subject areas, for instance, human physiology, psychology, and pathology as well. And I'm looking forward to pursue my career in medicine because it helps me to develop my problem solving skills and my researching skills as well. That's about me.
So I'll go second. Hi, hello everybody. My name is Jorah Shaheen. I'm a rising sophomore both at Coventry University, studying electrical and electronics engineering, and at University of the People, studying computer science. Currently, I'm a maintenance engineering intern in L'Oreal Egypt factory. I'm passionate about artificial intelligence, robotics, and data analysis, and dream of innovatively integrating them to achieve complete robot autonomy.
Hello, everybody. I'm Hidayah. I'm an engineering student. I really care about the exploration of one's mind and how shifts could be made starting from within. I like to be fulfilled in life and at peace overall. I have worked lately on a project to help chronic patients deal with COVID-19, and I'm really interested in product development and project management and have been noticed from IEEE Young Professionals for these skills.
Hello, everybody. My name is Dina Omar. I'm a rising sophomore at Bennington College, USA. I double major in physics and computer science, and I'm currently studying career development in my college and in a program in University of Amherst related to technology. And I'm really obsessed with the quantum computation industry and the quantum algorithms because it's like really bridges between the physics and technology, the two things that I'm really interested about. And it's like the next thing in computers, and it has like very cutting edge technologies. So it's really amazing. So yeah, that's me.
Girls, it's great to see you again. And hi, everyone. Good morning, good afternoon, and good evening, wherever you are in the world. We're all thrilled to be with you here today with Team Glukeeps. And girls, I have to say that I really love the Glukeeps app and the thought that you put into it really in its development and creation. So maybe we could start today by just having you share what inspired you to focus on this problem with your app and solution.
Yeah. So what brought us to this idea was actually educated, comprehensive steps. So first, we started by like searching the major challenges that generally face the Egyptian society and see which one has the less offered technological solutions so far. So we found that Egypt is like one of the most countries worldwide that has issues in the medical field. So we did like conduct surveys, read statistics, and asking physicians, and we found that the non-communicable diseases are the most problematic and the less monitored in our society.
Thank you, Dina. Dina, are you still there with us?
Yeah, you can hear me?
Yes, we can hear you.
You could hear me what I was saying?
Yes, I just wanted to make sure you were done. It paused for just a moment. Any other girls, anything else you would like to add?
Um, I I didn't finish, but sorry if my internet was bad that I posed.
Okay, Dina, keep going,
Okay,
please.
so you can hear me. Okay,
Yes.
okay, awesome. So I was saying that it didn't take too long to like see how much like people are affected in a certain disease that needs like a lot of monitoring and that can be solved during like using a technology or something. So when the diabetic fighters are like in the most need for the healthy lifestyle and the monitored vital records, the medications reminder and fast emergency response, and all of this can be achieved and can have a solution using a mobile application. So yeah, that's why we chose that disease to work on, and that's why we created Glukeeps.
Excellent. Thank you. I heard you loud and clear, Dina, so thank you. So let's move on to the next question. Then, how do inequities in healthcare personally affect each of you in your communities?
So basically, inequalities in any field or any part of life, can make huge problems in any place or anywhere. So some of the points I think mostly affected our communities were in the place we live in. More income contributes to a far better healthcare, like far better laboratories, normal sanitary clinics, and access to certain medication. Some of the medication can be imported from other countries that can make the price of the medicine sometimes, in some cases, 10 times higher the like normal price. What most people do is buy alternative medicine that don't have the same side effects. In other cases, it can be decided that some medicines won't be imported at all due to specific reasons, and sometimes it's due to the price. So people don't have the medicine at all. That leads to people with low income, but with the same level of health care needs as rich people are less likely to see a specialist because of, like the expenses of the whole process. Shortage of healthcare providers in certain areas, which can be pretty unfair, honestly, and could take up a lot of time to go just from city to city to see a healthcare professional. It can make them delay like a lot of daily activities, which can be pretty stressful. There's also inequality in the awareness levels that impact the lifestyles and behaviors of different people, which can be observant in the indolence and the harmful behavior, like excessive harmful behavior, like excessive smoking or lack of attentiveness when it comes to medicine courses. That tend to be higher in places of lower awareness than in places where there is good identification of healthcare services, benefits, and importance.
As my friend there said, I want to complete some of the inequality that we face here in our community concerning the medicine and those stuff. There are some physicians who totally rely on giving the patient doses and doses of medication without any peripheral reasons, and those medications may have adverse drug reactions that may affect the patient negatively in the future.
Yes, and also the problem we're trying to solve is the diabetes and other chronic diseases is one that could be easily relieved with the right follow-up treatment. Unfortunately, having the luxury of your personal doctor and regular checkups to follow your progress is one that just most Egyptians just cannot afford. Inequality of healthcare in Egypt is represented by how just a few people can get the high quality treatment relative to the majority. The effects of such inequality is evident through high mortality rates caused by long-term diseases that could have been avoided just by using the right follow-up treatment.
Thank you, Hidayah, Angie, and Yara. You should be so proud of yourselves. I just have to say that with all the great work that you've done. So maybe you could share with the group today, just have you been able to partner with any physicians or hospitals to help you in the promotion of your app and to help patients in need of diabetes care?
Well, to guarantee the credibility of our application, we have collaborated with certain physicians in order to know more about the disease itself, in order to know how to be easily managed by the patients, and also what are the difficulties that the patients wish to overcome in order to offer them comfort instead of the diabetic anxiety. We were more than welcome to ask questions, get the review after certain steps of the implementation process, and get some suggestions about how it can fit the diabetic's persona as well. In conclusion, with this evidence-based feedback that we have got from the physicians, we have developed some trackers and features in our application that will assist the diabetics fighters in their fight, including iodination and water tracker, medication reminder, also daily tips, tricks, and advices to the patients in order to change their lifestyle into a better one. And finally, we have made a simple medical network in cases of emergency, so it may save some lives.
Anytime you can impact patient lives, Angie, again, you should be really proud of your progress. So I think now we'll pivot to some of the questions about, bigger thoughts and ideas from each of you. So the question that we have is, do you believe it's important to have a diverse workforce of innovators in healthcare? And maybe you could explain why.
Okay, well, I'm going to answer that. Well, treating patients, especially when it comes to chronic diseases or mental illnesses, it requires not only a scientific experience taught in medical schools, but also a high level of empathy and understanding to the patients themselves. In most cases, when you diagnose a patient, you first and foremost just hear them talk about the symptoms. That's why I believe it's crucial for the healthcare industry to be as diverse as possible. Doctors need to understand the patients. They come from different backgrounds and cultures different than theirs. And also, having a diverse network of innovators and specific from multiple disciplines in healthcare can significantly enhance the efficiency of many aspects in the healthcare industry, such as medical history handling, follow-up treatment for chronic patients, the problem we're attempting to solve, symptoms tracking amidst the COVID-19 pandemic in specific, and also emergency services.
Yara, I totally agree with you. Having spent my life and career growing up in medical technology and pharmaceuticals, I agree there's a great need for better diversity across STEM and medtech. So maybe the next question we have for you girls is, why is it important for younger generations to focus on health equity and innovation in technology?
Okay, I can answer that. So health is a very basic and ultimately important human right. And health equity is giving everyone a fair chance to access medical resources and to attain the full health potential despite any financial obstacles or social disadvantages. So advising the younger generations to focus on health equity is like advising them to help in removing the barriers that would make anyone. As we see historically and practically, technology has been able to solve a lot of health issues and has been the ultimate solution, or like a step in the solution of a lot of stuff in the medical field. So I see that with technological tools, it can solve a lot of medical issues in the future because of its intelligence and innovation. So health equity and technology advancements are really essential in the process of making all people live in a welfare.
Thank you, Dina. Excellent answer. So this is one of my favorite questions. So what advice would each of you give to the girls who want to start driving innovation and solving problems locally in their own communities?
So I would say, like, one of the most important things that came up to my mind was just be patient mostly while doing your research to understand the community, because most of the times there are, community stigmas, and people may feel like they could be criticized when they talk or speak up. So basically try to give them the space and the comfort that they need to just really understand and listen to the people with, having these problems. So, just to let them answer and express themselves truly and openly, and overcoming societal stigmas. Because once you can understand how the mindset works, you can put yourself, in other people's shoes, and then you could relate to it more. Then you start to think in a direction that can lead the team to a better service or an application. The whole thing is not about just a service or an application. It gives more value when you just provide a better overall experience, not just the service, not just the application. So not like one thing in particular. So try to search for the right questions to ask. What I mean mostly is to listen and try to pinpoint details to find what the community is going through and in what ways are they suffering from this problem. Also, try to find a really good mentor, because it will help and it will make a huge difference, or an expert while implementing the solution, because the real implementation is the physical thing that can have an impact, and that can uphold your accomplishment. And talk about, that is the only thing that you can talk about that has an impact or a good impact. So finding someone or some people that can help you with the implementation, like with the actual, like the whole process. We want to do an app, so we'd like to have an expert that can help. We want to do like a community research, so we'd like to find physicians. We like try to find people who are experts in their field to help you more, bring a service with a better quality, and that would make a huge difference, especially in the implementation part.
Thank you.
Couldn't agree more
Go
with
ahead,
Hidayah.
Angie. Yeah, go ahead, Angie.
I was saying that I couldn't agree more with Hidayah. I just wanted to add my piece of advice to girls all over the world. I want them to trust the process. The process won't be full of flowers and butterfly. I'm telling you, the process will be surrounded by obstacles, hardships, and a lot of effort. But on the other hand, it will be crowned with impact, with experience, with success as well. So all of those factors will assist you into expanding your vision and broadening your horizons. That's it.
Thank you, Angie. Go ahead, Yara.
I would advise girls all over the world to just believe in themselves and in the fact that all of us can just, we can all contribute innovatively to our community's problems if we just think about them in the right mindset. Also, I would strongly recommend putting in the effort, doing your best, the best that you can, and then trusting that it will all pay off at the end, maybe in more ways that you'd expect.
And
Also,
Dina?
I wouldn't agree more with all of them. I want to advise the girl that work smart, not only work hard. Like put effort in the right direction, as Yara said, and think about the problem that's really essential in your community, and at the same time, it fits your interest and it fits your skill that can solve this problem. So like when you find the intersection of your abilities, your interests, and the needs of this in the community, you will find the best career and you will contribute massively.
Thank you, Dina. I love the advice that you gave your colleagues globally. Really excellent feedback. We did get, I would say, a compliment and a question in the chat. So acknowledgement that you did an awful lot of research to get to this point. And so the question for all of you is, how was that process in the beginning? I think, Hidayah, you started to answer that before as you sort of managed and stepped through the process. But how was the process in the beginning? And then how long did it take you to narrow down to the problem? So would any of you like to take that?
I could start. So I think, just um, picking one problem, I think that was like the major part that we really focused on. Just not trying to, like jump to solutions. We just really wanted to understand the problems and what type of a problem would be most beneficial. So it took us the most time. That was like the longest process to just pick the problem that we would be working on.
And also, I would say that picking the problem and defining a problem statement that we would like to work on just for the rest of the journey, it took the most time among all the other stages. And to reach a specific problem statement that we would like to work on, we did many forms of surveying. We just didn't, like, from experience, pick one problem. We talked with our parents, with our community, even students at our school, and also when we decided that we would like to work on something that is related to healthcare, we went to doctors and asked them, how can we contribute the most to solve a large scale problem in Egypt, but like, in a simple way and a way that could be digitalized in a mobile application. So yeah, it definitely took a lot of time to be able to narrow down to one specific problem, like something narrow, just like not chronic disease in general, but specifically diabetes.
Yeah, and I also wanted to add that, like, when you do like a project, you have like three stages: finding the idea or the problem that you want to work on, and design the solution, then the implementation. So like always, the finding the idea or finding the problem is the one that takes a lot of effort, because like according the problem, you will make a good solution and you will implement well. So like finding the proper problem is very essential stage. That's why it took a lot of research to, like, in a smart way, pick a very essential problem. And then the designing of the solution take more, like, another time, and the implementation take the less time, but it take the more effort. So like in terms of time, always finding the problem is the one that takes most of the time.
We also made a primary competitor analysis to know if there is any services that are offered to the patients of the diabetes is already available or not. So how can we contribute to this issue?
Excellent. I think you've given everyone a lot of great advice and feedback and thoughts to leave this conversation. It really has been my pleasure getting to meet you and know you, Team Glukeep out of Egypt. Again, you should be really, really proud. I think the piece of advice and listening to you, what I would leave you and your fellow colleagues with is, and we talked a little bit about this in the board meeting last night, board session, is just continue to be bold, be great listeners, great thinkers, bring your full intelligence to the table, because you're identifying needs and things that need to be solved for locally in your communities. And Yara, I think you said, be yourself. That's so important as you progress throughout your life and your career, to bring your full self into solving a lot of these problems and new innovative solutions. And I feel like I learned from you just listening to you, and I hope many others in the audience did today as well. It's super inspiring, and I'm sure you're inspiring a new generation coming up behind you that hopefully will reach out to you and seek your mentorship and feedback as they develop solutions in their own communities. So on behalf of myself, the board of directors, and Technovation, it's really been a true pleasure to speak with you today. And I can see you're on a journey for greatness, each of you. And if I can help in any way, please don't hesitate to reach out. So I think with that, we can turn it back over to Shivani, unless there are any other questions. But thank you for the pleasure of getting to know you a little bit better.
Thank you.
Oh, great job. That was so wonderful. I was just riveted, and the whole session went by so fast. I can't believe I'm already up here again closing out. I just want to say you ladies totally impressed me, and I want to close out by saying that for the audience, if you want to join Heather in supporting the next generation of healthcare innovators, then please consider donating to the 15-year anniversary campaign that is going on right now. She and the other board members are leading it. I think there will be a link in the chat, and you can also text 15 years to 7177 just to chip into the cause and support these other fabulous ladies just like Team Glukeep.
Hey, Shivani.
Yes.
I was just going to say, join me. I donated $2,500 this year, and I would welcome the rest of the folks on the line to do the same, please.
Wow, thank you so much, Heather. That's amazing. Thank you. Yeah, and that's not the only way that you can support. please, if you're interested in volunteering as a mentor, you can stick around. There's an info session later today where you can learn what it means to be a mentor or a volunteer judge with Technovation. But up next, we have a double whammy session. We have one on stage 1 and one on stage 2. So you can either join stage 1 to learn how to leverage your strengths to successfully pitch your business with Isthmus. They're a female-led startup. Or you can join stage 2 with MIT App Inventor and learn how to train and test a machine learning model on your phone. So both great options. You can't go wrong. Just pick the one that seems more exciting to you. Thanks everyone for tuning in, and we'll see you at the next session.